So good morning, everybody. Good afternoon, I assume. So I will talk about the Copernicus Thematic Hub on Health. Is no name on it because it's the work of everybody. You're all part of it, and all our users are part of it because it's really an exchange on between everybody. Probably your first question you have here is, I look unhealthy. I promise I don't have COVID. For everybody outside and here, why the unhealthy person is talking about health. It happens in his life. We're all concerned, actually, because health is on everybody. So it's important in health is our environment. Our environment has an impact on our health, and is where Copernicus can be helpful to solve the health question in predicting disease, predicting sickness, and how to prevent it. So I'm going on the same cube, and we are on the health part. So what is Copernicus Thematic Hub, even outside of health? Is actually in the world, we have different expertise. And we have some experts that, let's say, they're working on UV index, and they're really making these maps, and they're making this a lot of data, taking data from satellite and producing something really nice. But actually, how you related that to health? But you will have the GP who will tell you that, oh, actually, you're lacking in vitamin D, and you need to go outside and take a little bit of UV and a little bit of sunshine to get on. Then you will have a sunburn, and your GP will say, oh, actually, you need to be careful because you can have a skin cancer. And then you will have this pharmaceutical person who is developing a new treatment of cancer, which needs UV radiation to kick off. And he will send you to UV cabin, but actually, why not to go outside? Why not to take the UV from the sun? And actually, that is developing on interdisciplinary knowledge and application. And one application actually is doing that, is taking the UV index from CAMS to develop with pharmaceutical industry the good way to just go outside, take the right amount of UV particles to kick off this treatment. And what we want to do with the thematic hub is actually to be a little bit the Champollion, to have our rosette rock and make the link on between every expert and every languages. So here is a more official way to see it, more traditional way. So what is a thematic hub? And you can see actually the loop. So it's not a beginning or a ending. It started long ago by itself. It's always been there. It's always been a link on between environment and health. It's not coming from nowhere. It's always been there. And it's a process that is getting us that we're gaining knowledge and we're getting farther and we want even know more. So we're getting farther and farther and the loop is turning around. So what is health, actually? Because now we're looking at the thematic hub on health, but when I say health, what do you think first? Probably first you will think about physical health, because like I said, oh, I look not healthy because I have a kind of a cold. But it's also mental health, and it's also well-being, actually. And all of that can be linked with the atmosphere, with the landscape, with all is around you and in your environment. So why the thematic hub on health is coming at CAMS and ECMWF actually is not coming from nowhere again, it's coming from an heritage from COP first. So here is, for example, an example of COVID-19. And for the COVID-19, you can see that actually meteorological and air quality factors have been taken and have been used to better understand what was happening in the COVID-19. You know all about that because we have seen already plenty of presentation on the subject. We also contributed with EEA to the Health Observatory. So here is just one example, coming back to what I was saying at the beginning on the UV index. We had this UV index, we had this nice map, but actually, thanks to colleagues here who were working on the UV index, we've matched what was in our maps with what is in WHO recommendation, and we made something that was useful for the user. We are now working also on the quality of ozone and on the ozone plume in different locations, because that is also something relevant for here. If you look at what has been done actually with CAMS data for public health, it's not coming from nowhere again. We had already several applications using CAMS data as different level, as European, has really a regional level, and back again, we have here an example of UV radiation. It was also being using C3S with other stakeholder, and again, we have the Observatory on Health here. So it was not using just CAMS data, but it was also using C3S data. If you want to have a better look of what we have done in Copernicus phase 1, is this nice story. We have collected different topics related to health with C3S and CAMS, and you can find the link here or on the CAMS webpage or on the C3S webpage. And I encourage you to have a look. And to conclude the COP1 phase, it was the workshop done on Copernicus and public health by DG DEFIS in September 2021, and I encourage you to have a look maybe on some of presentation because he had a wide overview on the topic. Now let's move from COP1 to COP2. So our thematic hub will be on health, and you can see we have a user community, but we also have 6 services. And I just show you that what was done by CAMS and by C3S, but actually, what's about the other services? How we can interact with them? Because it's a Copernicus thematic hub. It's not just the C3S and CAMS thematic hub. It's a full Copernicus one. And also, we have a user community. So the one in bold are the one we already interacted with, but it's even more, and we plan to interact with them. So we have quite a wide community to go through it. So here is what we have done with Christina the last few months, is we have gone to seminars, we have gone to conferences, we have read a lot of articles, we interacted with some pupils, some users, and here is a summary of requested needs and requirements we have seen. And actually, we can already put them in different subjects like atmosphere, marine, land, climate, emergency. Oh, that looks like my 6 services. And already, we have identified some parameters that are already existing. We are not going from nowhere. We already have something here. So doesn't mean it's less work to do. We still have plenty to do. We're still in the primary phase. But still, we're getting there, and it's quite a bright future in front of us to build something together. And it's a project to be continued. Thank you very much.
Thanks a lot, Julie, for this very nice presentation. We have a couple of minutes before we need to go for lunch. I think Johannes has one.
Yeah, thank you for the interesting talk. I was interested whether in the hub you have already close contact to health professionals who can give very concrete advice. What type of CAMS products are useful for them? So is it the forecast, is it the exceedance, is it the long-term mean? Because it would be really helpful to shape our service.
So it's what I was planning to do in the future. You can see that actually is the physical health, is the mental health, is the well-being. All of that is really depending on how you see it in the time of structure you want to do. If you want to do an app, like telling you if today is good to go outside, you want the near real time or the forecasting system. But if you're studying that the impact of UV radiation on skin cancer, you want to have a wide database. So actually, what we plan to do is have this nice interface where you will be able, as a health professional, to go in the right direction to find easily what type of data you have. And effectively, we are on contact. We are in contact with people from health services. We are also in contact with much more like European Commission department, or we contact with people making applications. So we're already kind of covering a wide range of users, yeah.
Okay. Is there another question? Hugo?
Yes, I would like to thank you for this presentation. It was very nice done, and I think feels the Health Hub is in a good hand here, so that's very good. So I think the challenge indeed, as you identified yourself, will be to try to connect as broadly as possible and to to get the synergy between all these service activities. And I think here, I don't know if Maria is there and wants to say something. But I think, yeah, that's really a challenge, and we have to be important. It's important that at the end we represent that as more as Copernicus rather than as a CAMS activity, of course. No, that's well understood. Thank you very much again for this. Yeah.
Okay, all right.